Welcome to Budget Beats. In 2018, the Narendra Modi government launched Ayushman Bharat Pradhan Mantri Jan Arogya Yojana with an aim to provide accessible and affordable healthcare to the common man. Today, we will explore what the healthcare sector expects from the upcoming budget. To talk more on this, today we have with us Dr. Abhinav Akhilesh from Grand Thornton, Bharat. Hello, sir. Welcome to the show. Sir, my first question to you is, when we talk about the upcoming budget, do you see that there is any specific areas in which there should be an increase in budgetary allocation, specifically when it comes to the healthcare sector?
What I would like to see, though, is slightly more allocation to the Health and Wellness Center initiative, because what has traditionally lacked in India, though we have managed to build tertiary hospitals and big infrastructure, but the primary and secondary infrastructure, especially in the rural areas, has been lacking. So I would like to see an increase over there. Secondly, other place where I would like to see an increase is some of the training centers, such as nursing colleges, some more paramedical colleges, if not necessarily medical colleges, because if you see especially the big states, UP, Bihar, MP, they have huge lacuna in terms of the number of healthcare personnel that they have.
Yeah.
So in order to build that pipeline, we need to have a huge spend on that as well. Thankfully, the spend on out-of-pocket spend has come down because of Ayushman Bharat program.
Okay, now how do you see the government, in a way supporting the private healthcare sector and their growth while fostering the public infrastructure?
See, the Ayushman Bharat program is supposed to be a game changer. It's the largest of its kind of public insurance. Obviously, there are issues in the government being a payer in terms of the payouts that have been going to the private providers, in terms of the rates that are there. What the government needs to do is to give more authority to independent regulators in terms of setting the rates which are market realistic, etc. And also work with the private sector providers, especially the small and medium-sized players, which tend to be the majority of the providers in tier 2, tier 3 towns, where a large part of the need is, to see how they can fulfill those needs. Secondly, also needs to push awareness of the Ayushman Bharat scheme where insurance is available. What has also slightly, I personally feel, has been lacking, that the people who are not covered by this program, giving them some sort of incentive to take up private insurance on their own and making the insurance schemes slightly more user-friendly, slightly easier to disburse. Out-of-pocket expenses have gone down below 50% for the first time in the country's history, which is a very good sign. But things like outpatient procedures, things like dental, things like optical are still not covered by and large by health insurance schemes in India. So if government really works with the private sector to see how it can fulfill those things, how it can maintain market steady rates which are remunerative to the private sector while not being a burden on the government exchequer, that would be great.
While we are speaking of Ayushman Bharat, when we talk about its awareness, its cognizance, do you think there is enough awareness when it comes to the eligibility, who all can go for it, and taking an extension of that, more schemes and initiatives when it comes to the health insurance for not just the lower middle class, but also the middle class?
See, there's no one answer. There are states where the awareness is quite high, where the state government has really pushed this initiative. Not necessarily the Ayushman Bharat, but where it has also combined with its own state insurance scheme. States in the south, some of the states in the east and west as well. But by and large, the big states, if you see UP, Bihar, MP, I think there's still some distance to go. They have done very well over the past 4 to 5 years in terms of promoting awareness, but there's still some distance to go. But what I would also say is reiterate my earlier point, that it's not just about the beneficiaries of the Ayushman Bharat scheme. It's also people who are not beneficiaries. How do we push them to take up insurance?
Yeah.
Can the government come up with a scheme where it's a blended finance model, that they pay part of the premium, etc.? That is really the gap that I foresee going forward. Because colloquially speaking, and there's no sort of set data on this, but what we are seeing on the ground is, while the coverage of insurance obviously in rural areas has gone up significantly, but that delta in terms of the lower middle class and the middle class has not really moved the needle. That is where it significantly needs to move.
Yeah. Again, speaking on that, when it comes to the rural infrastructure, specifically healthcare infrastructure, it's lacking in a lot of areas in comparison to urban. And if we take look back at the pandemic times, we have seen that the massive lack that there was there. Now that there's again a new coded variant, and we have seen upwards of 3,000 cases that have been registered in India for COVID variant JN1. keeping that in mind, how do you think if we are looking at a pandemic on the horizon, are we prepared to tackle with it again, or what are the new infrastructure the government should keep in mind and go ahead with that?
Well, I certainly hope we are not facing any such situation anytime soon, but pandemic preparedness is something which not just India but governments across the world have woken up to. And what they have realized, it's not just the traditional healthcare infrastructure, but readiness in terms of the emergency response teams, readiness in terms of population health, that has to fall in place. I think especially in rural areas where more than infrastructure, I believe skilled manpower and skilled resources is the issue. What we should look at, what are some of the innovative ways and we can provide healthcare while bypassing some of these challenges. Assisted telehealth is a really interesting model which we have seen work in pockets. Telehealth standalone has not been very effective, but assisted telehealth is something what we are seeing. Converged models with the Anganwadi system working closely. Working with again the private sector, incentivizing them to open maybe mini health centers in rural areas. That is a model which has seen some traction. Also, one very interesting model which I personally believe will be effective in the long term is creating these rural health entrepreneurs, which can at least provide preventive healthcare, especially to expectant mothers, young children, because there has been significant scientific data on how poor nutrition during childhood is an indication of how the kids suffer from chronic and acute illnesses when they grow into adults. So some of those interesting models maybe the government needs to look at, which have already worked. What needs to be done is to test out how scalable they are and how they could be funded, and then perhaps roll it out. And I cannot stress on how important it is to work with the private sector. Because while we have seen a lot of innovation come from government, I believe utilizing the strength of our private sector is really, really critical here.
When we're talking about last year Nirmala Sitharaman said about sickle cell anemia. Do you think we're on track with what she had promised about no women suffering from sickle cell anemia?
Sickle cell anemia is very difficult to eliminate. We have globally there are good models, but I think it's too early to say whether we are on track or not. I think we need to see a few more years to say whether we are on track. India has had a good record in terms of eliminating, especially these type of ailments. Guinea worm, polio, was a huge challenge, but we did manage to do it. We have to really take a mission approach to it. And I think the approach that the government is taking, not just towards these diseases, but even diseases like tuberculosis, which is a huge burden on not just the health of the country, but also economic outcomes, because people suffering from TB, decline in productivity. The approach is good. I think what we need to do is maintain it consistency and also look at pockets where it's not working well, really work in a focused manner in partnership with state governments, community-based organizations, and again, I must stress with the private sector as well.
Okay. I also want to understand when it comes to the research and development, specifically in the medical area in the country, do you think the government should, in the upcoming budget, the government will put a focus on more of research and Indian-made research and development?
That's a very good question. I think not just in the healthcare sector, I think across all scientific areas, we have sort of, I would say, not been a front runner, to put it mildly, in research and development. I think this government last year came up with the scheme where it is incentivizing research and development, but I think we are still below below 0.5% in terms of our percentage of GDP what we spend on research, and that reflects on how many patents we have, how many new drug discoveries happen in India. So that there's really a need to push the envelope, not just with government spending. Obviously, the most bleeding edge technology has traditionally come from public institutions, but really reviving those institutions in terms of cutting edge research, but also incentivizing the private sector, whether it's hospitals, whether it's pharma companies, whether it's private institutions, whether even private researchers. How do they get incentivized? How do we get them an ROI? But more importantly, more than the spending, etc., I think there has to be a relative cultural shift in the mindset. As Indians, we are traditionally, I feel, very scared of failures. I think now, with so many startups being successful, I think people have started becoming more accepting of failure. And I think that giving that room to fail and, accepting that, failure happens and it's a good thing, because we always know of the successes, but there are 1,000 other failures behind it. Those are all learning steps to the success. I think that cultural shift is also necessary.
Because I always found it interesting when it comes to R&D, we are not that great. Considering the fact that India is one of the top ranking countries when it comes to hospitals or medical tourism. So we have a lot of people coming into the country for the medical purposes. Yet when it comes to our own R&D, we are a bit behind in that.
I think it's structural, and I said cultural, which I will not repeat, but also structural. Our institutions have not been designed really to reward innovation and research, right? I think those needs to be relooked at, but that's changing.
Yeah.
We saw with the vaccines coming up that the Indian institutions really stepped up. I think the API market we need to bring back to India, which we have lost a significant share of. I think addressing those structural issues while also pushing culturally for Indians to become innovators. I think with this program which the government launched last year, I think there will be a slow path to success. It's incumbent upon all of us how we accept this cultural change, how we push for it, not just the government's prerogative alone.
So lastly, if you have to give your recommendations for the budget, what do you expect government should prioritize or focus more on?
I would just say two things in terms of budget allocation, and one more thing in terms of maybe policy pushes. Two things in budget recommendation: push more for primary and secondary infrastructure, especially in rural and peri-urban areas. Second, I would suggest pushing for more nursing and paramedical colleges, apart from medical colleges, of course, to create that big cadre of healthcare workers. And in terms of policy push, as I mentioned, how do we incentivize people taking up even private insurance where they're not eligible for government insurance? I think if these three areas are there, I would be a happy person.
Thank you, sir. Thank you so much. So there you have it. Do let us know what do you expect from the upcoming budget in the comment section. And for more in-depth analysis of the budget, keep watching Zee Business.